Okay, let's go to start the live webinar. Let me ask Mustafa to join us. Mustafa. Hello, Mustafa. How are you doing?
Hello, Ali. Can you hear me clearly?
Yeah, your voice is clear and everything seems good.
How
Thanks
are
for
you, brother?
joining us. Thank
How
you.
are you, brother? Is everything okay?
Yeah, everything is good, and thank you for joining us. I hope it will be a good discussion and a good webinar for all the participants. Thanks for accepting our invitation.
I especially want to thank you for inviting me. And today I'll ask the questions to you, and this time you are going to answer it, okay?
Okay, it's okay for me. I
Okay.
hope I can answer all your questions correctly.
Do you want me to start, or do you want to say anything before starting our webinar?
I have prepared some information about the dental microscopes and loops. I can start with a brief introduction, and then we will go to see your cases, or you can ask any question you want.
Okay, at first, I want to add something if you let me,
Yeah,
Raleigh.
sure. Go
We
for
are
it.
today here on the behalf of Expedient Academy, and as everyone started to see on social media that we are the new key opinion leaders of Expedient company, and this company Expedient has really very good endo products, and
Exactly.
we are trying to introduce these great devices to endodontists and dentists. And today, I have started to try loops of Expedient, and I'm really very satisfied with these loops. I think we are going to discuss about the loops in the webinar. So let's start. And I want to ask you a few questions, but before that, I think you can start your webinar, and after that, I will start to ask you questions, okay?
Okay. No problem. So let me start with a brief introduction about dental operating microscope. Uh, uh, I will tell my actual introduction as much as brief as possible, but I want to show you a good actually article about the impact of loops and microscope on the vision in endodontics. In this study, dentists older than 40 years old were not able to see different
Ali,
actually, or if
excuse me. Can
yeah,
you adjust your phone just to show the whole screen? Okay,
it's not good.
now it's good. But
It's
we
good.
cannot see the whole screen, but now it's better. Okay, it's better. You may
It's
go.
better.
Yeah.
Okay. Thank you. In this study, it shows that the younger dentists under 14 years old could see a 0.05 millimeter structure at the root canal orifices, in contrast to older, actually dentists which are older than 14 years old, which were not able to see these orifices separately completely. It shows that when we get older, we need to actually use magnification, and it depends on the age of the dentist. So the age is an important factor for dentists to use actually magnification. When you get older, it gets obligatory to use magnification. Let me start with the loops. Loops, I think it's very familiar among all the dentists. And we have two types of loops which you can see in the market. Galilean system and the Kaplerian. Kaplerian system is the newest one and has a higher range of magnification, which can be up to, for example, 6 diameters, and it is going to be better than Galilean one. The disadvantage of loop is that the maximum magnification is actually limited, because when we compare loops to dental microscope, we can see that they are not as good as dental microscope, but we can still use them in any field of dentistry. These are two types of magnification, as we talked about, Kaplerian and Galilean, which Kaplerian is the latest generation of the loops. The factor of light is very important in loops, and specifically in dental microscope. For example, Expedient company has provided a good headlight lamp, which is very so actually light, and you can install it on your dental loop and you use the light. The light affects on the quality of the image and the actually quality of the lenses when you use light. The source of light actually is the most important part of any magnification. If you want, if you don't have any good light source, you cannot see the actually details you want to see. There are different types of loops. We have customized, which we can say flip TTL or TTX, and we have actually the flip up loops. As we can change them by our own decision. These types are actually, this one is flip up loop. You can change the interpupillary distance by your own. But when you use customized loop, it is specifically designed for your interpupillary distance for your eyes. And the ergo loops are the last generation of the loops, which helps you to actually maintain your ergonomy when you want to perform any dental or specifically endodontic treatment. This is one of our resident in our university, which she is using ergo loops, and you can see his posture and ergonomy that she has when she uses dental loops. Dental microscope is the last generation of the magnification. The father of dental microscope is Gary Carr, which is the first one who has introduced the dental microscope in the field of dentistry for several years ago. The dental microscope has a different range of magnification, which can be from 3.5 to 30 diameter, and it can be mounted on ceiling or you can use on the wall, and it is your decision to how to use your magnification. I will pass this. And in this slide, I want to show you the mechanism of creating an image in our brain and by a dental microscope. The light comes from the object and then pass through the objective lens and the eyepieces lens, and in our brain, it will come to only one image. Actually, there are two types of image which are parallel, and in our brain, the image can be analyzed in one picture. This is the main difference of the microscope and loops. As you can see, when you use loops, you have a convergent actual light source. It means that you have a place, it's like you have placed actually object in as close as possible to your eyes, and it is not as good for your eyes in the long term. But when you look at the dental microscope, it seems that you are looking at an object in a distance, in a very long distance. And it is not bad for the health of your eyes. This is the main difference of the actually dental microscope and the loops, which it is about the distance of the image to your eyes. And this diagram tries to show you the range of magnification, which the magnification in the microscope has a very wide range in comparison to the loops, which is only about 2 to 8 times bigger in the loops. In this picture, I want to show you the different parts of the dental microscope. We have some knobs for adjusting the focus length about, and there is a knob specifically designed to change the magnification. And in every dental microscope, you have adjustment knob, which you can change the interpupillary distance, or for example, you have a knob for diameter adjustment. And these parts are actually you can see in every dental microscope you want to buy. Every magnification has different meanings. In every stage of the treatment, we can use different actually range of magnification. For example, if you want to prepare your access cavity, you can use 8 or 16 diameter magnification. But if you want to see clearly or you want to see more detail, for example, if you want to detect orifice, or we want to see fracture lines, or we want to locate calcified canals, you have to use higher magnification as shown in this slide. And these actually details are the same when we want to use microsurgery or surgical endodontics. The light sources in the dental microscope is something somehow different from loupes. The first generation of the lights were halogen, but now we can use, and the manufacturer has changed to xenon or LED sources. LED sources has the average life, and it is actually the cost effectiveness of the LED source is better than the other types of light sources. And I want to focus on this part because the variofocus length is very important for dentists. I think the best range for variofocus is about 150 millimeter to 450 millimeters to 450 millimeters, because it accommodates every types of person with different heights. For example, a short person needs a lower range of variofocus, but a taller person may need the higher range of variofocus. And when you have a wider range of variofocus, can be suitable for different types of person. And this is the impact of magnification on a $1. As you can see, when you use magnification for $1, you can see more details. When you use a higher magnification, as you can see, different lines and different dots that were used on the printing of this $1. There are prerequisites and there are instruments which are necessary when we use rubber dam, when we use dental microscope. For example, rubber dam placement is necessary, also necessary. We have to use indirect position. We need to work with mirrors. We have to use some key instruments which are specifically designed for microscope. For example, micro instrument, micro mirrors, micro blade. And we cannot say that the dental operating microscope is enough for every treatment. We have to prepare the instruments that are designed for using under magnification with dental operating microscope. As you can see, when we talk about the micrometer, you can see how small are these micrometers, and you can compare the micrometer to the ordinary dental mirror, and you can see they are very small and they are only can be visible on the under the magnification. The different parts of dental microscope, I just want to say them as fast as I can. We have eyepieces, binoculars, magnification knob, as we can see, focusing knobs, objective lenses, beam splitter. Beam splitter is a part that we can use when we want to record the video or we want to share our cases with our patients. We can add an external monitor to our dental microscope. We can add different video captures if we want to record our videos and pictures and so on. Let me pass and we can talk about these objectives. There is a good options in every dental microscope, specifically in Xpident microscope. You can change the angle of binoculars in different position, and it will help you to maintain your ergonomic position when you use microscope. If you are not able to actually change your binoculars angle, you were not able to use a dental microscope in an ergonomic manner. This part is, I think, is very important, and every person who wants to buy a dental microscope should ask the company to add this part. And this part is car extender. Car extender help you to get as far as possible to the patient, and it will help you to maintain your position and your ergonomy. As you can see here, when you add car extender, you can use dental microscope in a better position and in a better ergonomy if you add this to your dental microscope. Let me skip the hard part. And this is the beam splitters and the part that we can add to our dental microscope if we want to add, for example, external camera, external monitor, and these parts will help you to add this, and you have to ask your manufacturer or company to add these options before you get or buy your dental microscope. And this is the different types of source, and you can see the quality of different types of light sources in this picture. The xenon light is considered to be the best actual light sources, but in the modern technology of the LED, we can see that the difference between xenon and LED is not as significant as in past. So LED light source can be good as xenon source because it is more cost benefit. And there are also some filters for your light sources, which is green and orange. Green is used for your surgery, and orange will help you to use your dental microscope when you want to use composite or any material which can be cured under normal light. And it will help you to have more working time when you use, for example, composite with dental microscope. And these are the different optional attachment and upgrades you can add to your dental microscope. My suggestion is the car extender is one of the most important one, and the other part, it is optional for any dentist who wants to buy and order their dental microscope. Dental microscope has some advantages and disadvantages, as many as invitations in the history of dentistry. The advantages are obvious. You have increased diagnostic power, you have broader therapy treatment spectrum with the dental microscope. You can reduce your trauma to the patient or to the teeth when you use microscope. The patient's comfort can be increased by the dental microscope, and you can have a better ergonomy when you use dental microscope. For example, imagine that you have been working 8 hours in this posture and position in comparison to use dental microscope in this position and ergonomy. You can see that this is not actually a damage to your body and for your different parts of your muscles. And this is the impact of magnification in the field of surgery. You can see how small and how good is the healthy of the periodontium when you use dental microscope in the field of dentistry. And also then the dental microscope is better for the patient communication because you can capture any photo in any steps of the treatment, and you can show them to your patients, and they can accept your treatment or any change in your treatment plan better when you have dental microscope. Because, for example, when you see a crack or fracture line in your treatment, you can capture a photo and then to show it to your patient, and they can accept that their tooth is not actually maintainable and they have to extract the tooth. But there are some advantages about dental microscope. For example, you have to follow a learning curve. The first time you use dental microscope, it is hard for every person, but as the time passes, you can get more familiar with the dental microscope, and you can see it is get easier for you. You have to provide more instrument tools for your dental microscope, and the expensiveness is very important about the dental microscope. The longer sessions you may have when you use dental microscope, and your assistants may need the learning curve to be accommodated with the dental microscope. There are some actually chairs that have been manufactured for using under dental microscope. It will help your hand to have a resting position, and it will decrease the damage of your hands and arms. And this is the image of using these arm chairs for your dental microscope. When you use dental microscope, we have different types of motions in our body, and the best one is class 1 motion. In this motion, you only use your fingers when you want to do something. But in other class of motion, you have other joints and muscles that are engaged in this motions, and they are not good for your body health. But when you use dental microscope, you can only use your class 1 motion, or at least a class 2 motion when you are doing your treatment. It is better for your hand health. As you can see, changing the instrument under dental microscope is harder than the usual time, because your assistant can understand your posture and your hand posture and change your instruments very skillfully. So you have to train your assistant to accommodate with these changes. And about the position of the dentist when he or she using dental microscope, I think the most position and suitable position for any dentist is 12 o'clock time for the actually dental microscope. It is the best position for any treatment you want to do for your patient. Let me skip this and go to the main part. I want to share these cases to see the impact of dental microscope on the different stages of the treatment, from diagnosis to treatment plan, or even in the every steps of the treatment. As you can see, when you use the magnification, you can see any crack or actually leakage on the margin of your treatment and your crown. For example, in this crown margin, you can see a leakage very good, but if you use naked eyes, you may not be able to see this as good as when you use magnification. Or you can find any fractures or crack lines when you use magnification. You can add methylene blue if you want to see better, but magnification can be enough to see these fracture lines or crack lines. When you want to remove any pores, when you have a dental microscope, you can go and remove the any pores as minimally as possible, because you know where to put your ultrasonic tips to loosen your pores. Or if you have any extra canals, for example, in minimolars, in upper premolar, which has the 3 roots, you can find extra canals very better when you use magnification, as you can see in these cases. We have talked about these parts, and now I'm at my actually clinical cases. If you have any question, I am ready,
Yes.
or we can continue. And
Okay,
this was
okay.
just a short brief.
Okay, Ali. I want to ask you some questions, and later you can show us your cases, okay?
Okay.
Now, at first, thank you very much for your informative, brief magnification webinar. It was really very informative, and thank you very much again for that. At first, I want to share a few images for our followers. You can follow Dental's Instagram page named Dental International, and also for the website, it is, can you see it clearly?
Yeah, it's completely clear.
And you can see the old products for Endo. You can find them here, loops, endomotors, and microscopes. You can find everything in that website. Now, Ali, I want to ask you a few questions after your informative lecture, okay?
Okay, I'm ready. Yeah, thank you.
Which one is better, Ali, do you think? Loops or microscopes? Which one do you advise to GPs or endodontists?
As an endodontist, I suggest the dental microscope, because the wide range of magnification is very helpful. For example, we have some types of actually procedures that we cannot do them without dental microscope. For example, if you want to remove any fracture instrument in the root canal system, you cannot remove them or do any extra treatment if you don't have a dental microscope. Loops are not sufficient and enough to managing such cases. And I think as an endodontist, a dental microscope is necessary and a must. But for GP and general dentists, I consider loops as an intermediate magnification. If they are not able to buy and accommodate for any dental microscope, they can use loops because they are beneficial for GP cases and their treatment. For example, if you want to do any treatment or if we want to remove any caries, and the routine cases are possible to be done under magnification with loops. But as an dentist, as an endodontist, I cannot say the loops are enough or good for endodontists.
Ali, for the ones who want
Magnification
to buy,
with
I think there's a connection problem.
okay,
Ali, can you hear
yeah,
me right now?
yeah.
I think
Well,
there's a connection problem with your
I
side.
think it's now fixed. There's no
Okay,
problem now.
it's better
Have you
now. Then,
heard my explanation?
yeah, I heard it. We heard it clearly. Now, Ali, then for the ones who want to start with loops, which magnification size do you mainly advise them? Start with 2.5x
Hmm.
or 3.5x or 4.5? Which one do you advise them to buy for the
Uh,
starters?
it depends on the types of the person and types of the treatment that every dentist do in their daily practice. For example, I have suggested my colleagues to buy 3.5 loops, but when they use 3.5 loops, they may say it is not enough or it is very high for them. I suggest that every dentist, when they want to buy any magnification for their loops, it is best to actually rent different magnifications and try different magnification and then see which one is better for the treatment. For example, a person want to just see a little bit bigger than a little bit higher, but
Then,
it depends on the actually person, I think.
Ali, isn't it possible to remove a broken file from the root canals by using loops? Do we have to use microscope to get the file from the root canals?
If the fracture instrument is in the coronal third of the root, it may be possible somehow if you are able to see it with loops. It is somehow risky, actually, but if the instrument fracture happened in the coronal third part of the root, it could be possible somehow. But the magnification isn't enough. You have to have the instruments that are designed for fracture removal too. Some dentists may think that they have loops, they can remove any, or dental microscope, they can remove any instrument they want.
Then,
They have to buy the instrument that are designed specifically to remove fracture instrument. But for coronal third part, somehow it can be possible,
okay,
but with a higher magnification.
okay.
For example, 6.5.
Ali, is it necessary to use dental operating microscope from beginning to end? What do you think about it? For example, you are performing a root canal treatment. Do you have to use it from beginning to end?
It is not necessary, but it is possible to use magnification. For example, some dentists or some endodontists use magnification even when they want to inject any anesthesia. It is not bad or good, but it is your choice. But in some parts of the treatment, it is necessary and it is obligatory to use magnification. For example, if you want to check if there is any remnant of gutta perca in retreatment cases, or if there is any remnant of debris in your root canal system, it is better to be checked by your dental microscope. But it is not necessary to completely use dental microscope in every steps of the treatment.
Ali, do we still need tactile sense in endo if we have dental operating microscope? What do you think about that?
I think the most skill for every endodontist that have or not having any magnification is tactile sense, because we can see only the straight part of the root canal system when we use dental microscope. If we have any curvature, if we have any deep splitting in the root canal system, we still need the tactile sense. For example, if you have any ledges, for example, if you have any perforations, there is still need of tactile sense, but dental microscope will help you to use your tactile sense better and more easily. For example, in the deep splitting root canal system, you know very exactly to precave your file and put your file in the, for example, lingual canal, which separates from the main canal system. It will help you to use better, actually.
Okay. Very good. Then Ali, for example, I will decided to buy a magnification system. Okay, how can I choose a good dental operating microscope or a loop to buy? How can I choose the better one? What do I look for to choose the best?
Uh, as we talked about, the main parts of the dental microscope, every dentist or every colleague that want to buy a dental microscope loops should follow those structures that we have talked about. For example, they have to be sure that there is, for example, correct standard in the options of the dental microscope. And I think the most important thing about any microscope is the clarity of the lens. They should be actually, they should emphasize more on the quality of the lenses, because I have the experience of using different types of dental microscope, and I have seen that when they do not have good lenses and the good quality lenses, you may not be able to see the details that you want. The most important part, I think, is the quality of the lenses, in which country or which actually manufacturer has built those lenses. And the other part, I think, is important. For example, they should be completely ergonomic in different position, different actually procedures we want. They should accommodate their orientations, and they could be completely ergonomic. The ergonomy and the quality of the lenses, I think, the most important things about the dental microscope.
Today I have had the chance to try this loop, Carbon X,
Carbon X.
from Expedant. It's an adjustable ergo loop. You can also adjust the distance between the lenses, and it is too light, Ali. You even cannot feel the loops on your nose. Really, it's so
Wow.
light. And for the first time, I used this Carbon X loop, and I can really advise everyone once try this Carbon X loops from Expedant. It has really high quality and also very light. And as I mentioned, you cannot feel the loop on your nose, because I have tried many loops. Some are
Yeah.
really, really heavy, and after using it in a certain amount of time, you can feel this heaviness on your nose, and it makes you uncomfortable. So, in my
Yeah.
opinion, the weight of the loop is also very important.
Yeah.
That's
Exactly.
why I enjoyed using this Carbon X loop from Expedant a lot. And Ali, could you please show your great cases to us by using dental operating microscope before finishing our webinar?
Yeah. Sure. Sure. I think the most important thing about the expedient loops is that they have used carbon technology in their products.
Yeah.
Carbon will change any products into a lighter, actually, version, and it's very important for the loops, because when you use very loops that are very heavy, you may have a strain on your neck, and you will feel the weight of the loops on your neck, and it's
Ali,
not good for the long term.
today I also tried these customized loops. These are also not very heavy. These loops are also
Yeah,
light.
right. They are lighter
Really.
because they are customized. Yeah.
And really, they are really in high quality. I really enjoyed using Expedance loops.
Very good.
Okay, Ali, now
Let me
we
go.
want to see your
Yeah.
cases, okay?
Okay. The first case I want to share is this case. As you can see in this first mandibular right molar, there is a big perforation in the forcation area, and you can see there is a 5 fracture in the PDL.
Oh
And in
my
this case,
God.
yeah, it is a tragedy. But the patient
Yeah.
was, this case was for my residency program, and the patient was very eager to save her tooth and asked us to save it as much as possible. So as you can see, in this case, we have different types of challenges. We have 5 fracture, we have a big forcation perforation, and there is also calcification in mesial roots. And this is the reason of forcation perforation. The previous dentist was trying to find the mesial canals, and he or she wasn't able to find the mesial canals, and she or he has perforated the tooth and used the rotary file in the perforation area, and you can see the 5 fracture in the PDA. I have used dental microscope, and you can see here I was able to see both mesiolingual and mesiobuccal canals here. I have
Yes.
located those mesiobuccal and mesiolingual canal, and I was able also to repair these large perforation with SEM cement. This treatment was not possible without using a specifically dental microscope. I don't think if I had loop, I was able to do this treatment as easy as you can see here. But this is the magic of dental microscope. You are able to do this treatment. And you can see I wasn't able to see the 5 fracture in the PDN because there was a mass of granulation tissue, and I didn't try to remove the fracture instrument in the PDL. But I just followed up the tooth, and you can see there is a healing in spite of the fracture instrument in the PDL after 18 months. And patient was completely asymptomatic, the tooth was completely functional, and there is no need for removing the fracture instrument. It could be there as long as it is not
So Ali, the fracture instrument is in the bone?
Yeah,
right now?
Yeah, it is in the bone right now. And I didn't go for any surgery because if I
Yeah, we don't need.
went, yeah, we don't need. You have to remove many bones to remove just a small piece that is not actually bad for the patient. And there's also another case. This is the mandibular premolar, and you can see it had complex anatomy. It may be, for example, 2 or 3 canals in this tooth. I ordered a CBCT based on the ESC position joint statement. We can order CBCT in complex anatomy cases if we want to look better to see how the complex anatomy of the tooth. And I want to share these CBCT with you. You can see we had 3 roots. This is the lingual and 2 buccal root. This is a 3-rooted.
Oh my God. 3
mandibular.
root,
Yeah, 3-rooted.
mandibular premolar.
Yeah, exactly. And this is the axial plane, and you can see the 3 canals which separate a bit at coronal flare. This is the mesiobuccal, this is dissobuccal, and this is the lingual canal.
Ali, I have treated maxillary premolars with 3 roots, but not any mandibular premolars. You're lucky.
I'm not lucky. I have a bad luck because I have to deal with these cases.
But you are using microscope.
Yeah, and the main actually complexity and the main challenge with this case was to remove this dentin shelf to access to the mesiobuccal root. You can see we have to remove this dentin shelf to access to the mesiobuccal root. And it is very hard to, in the clinical case and in the clinical situation, to exactly removing this part of the dentin in the root canal system. As you can see, I have. So I used the measurement on the CBCT, and it showed me that I have to go 9.6 millimeter from my reference point and remove the dentin shell. And this is the thing that I have emphasized very most in my presentation, you have to buy instruments that are specifically designed under magnification with DOM. For example, I use Mount's Discovery Burst to remove the exact point, the denting that I wanted. And finally, you can see I have located and prepared all 3 canals here under magnification with dental microscope. And you can see finally the obturation part. And in this picture, I want to show that you still need tactile control, tactile sense, because in some cases you are not able to see complete splitting, and you still need to use your tactile sense, as you mentioned and asked me. And in this case, I was able to locate all the canals and completely obturate the case.
Congratulations, very good case.
And another case, as you have talked, we have many mandibular premolar with 2 roots and 2 canals. And you can see this image when you use dental microscope, you can see where the splitting part is in the root canal system. And if you don't have any dental microscope, you should only use your tactile sense. But in this case, you can use your tactile sense better because you know where is exactly the point that the root canal system separates. And this is the separation of the 2 canals under magnification with dental under microscope. Okay. And this is a demo for my students at the university. I have used dental microscope to put an apical plug under magnification. You can see when you use the dental microscope, you can see where exactly you have put your empty material, and you can pack it exactly at the length and the working length you want under the magnification. But if you don't have any magnification, or if you have loops, you are not able to see the apical part of the root canal system. Yes, it's impossible. But you can see with the magnification and a good light source, actually the straight part of the root canal system, and I use a magnification to place my empty plug in this central incisor.
For example, Ali, it's not possible to make an apical plug with loops, huh? I don't think that it's possible.
I didn't have tried that because
not so
my
easy.
chance
Maybe it may be possible, but it's not so easy to place.
It's possible.
The apex of the root canal using loops.
Yeah, I think, but the difference between the naked eyes, I don't think is significant when you use loops.
No. With naked eyes, it's impossible to place appropriately the media at the apex of the root.
And this case is very important for me. For example, if you want to do selective retreatment, you have CVCT and you see that the only reason for the previous root canal failure is, for example, a missed MB2 canal. And in this case, there was a crown on the tooth that I was going to retreat. And you can see I can use only a small access opening to only retreat the mesiobuccal root of the upper maxillary molar. In this case, I have found the MB1 and MB2, and I retreated these 2 canals to retreat my case. You need CBCT in such cases because you have to be sure about the other root canal system that they are not infected. And when you want to do any root canal treatment through the crowns, for example, it is primary treatment or retreatment, if you don't have magnification, you are not able to see your pulpal map because the magnification and the light sources helps you to see through the crown. When you use naked eyes, because of the light source, you see only a dark part in the crown that you have prepared for the access. But when you use magnification, I think it is possible to see this picture with loops, but the best quality actually image can be captured by the dental microscope, as you can see here. This was a retreatment case through the crown, and I have done that under dental operating microscope, and you can see I was able to see the full root canal system only with a small access opening on the crown. And there is no need to remove the crown, and the patient, and this treatment is completely cost benefit for the patient because the crown was satisfactory and there was no leakage on the crown, and I was able to do my retreatment by a small access opening on the crown.
Yes.
And that was my case. And if you have any question, thank you, Mustafa.
It was really great
Thanks for your clap.
lecture. Can we see you, Ali?
Yeah.
Okay. Thank you very much, Ali. It was really great. I enjoyed listening to you so much. It was very informative. And I think our followers will more often see us for the
Yeah.
webinars because we are a new team and we will do our best for the next webinars. Thank you very
Yeah,
much
sure.
for your informative lecture. And also, I would like to thank our new company, Expedient. We are the new key opinion leaders of this great company. On the behalf of mine, I'm really very happy to be a part of Expedient because I really enjoy using their devices. They have really have high quality. And what do you want to say before finishing our live?
Same as you, I am very interested that I have the chance to work with Expedient company, and I'm very happy that me and you are considered as the KOL of the Expedient company. Their path to the future, I think, is very clear, and I see the light in their future because the quality and their impact on the dental market can be very impressive in the near future, as you know, because they are dedicated to the quality and they are going to be better in the future. And I'm very happy that I have the chance to work with Expedient company, and specifically you as my great friend, great scientific friend. And I always enjoy your words towards our field of dentistry, specifically endodontics. And it is a great chance and honor for me that I have you by my side. And I will be happy if we could plan more programs, webinars like this for our colleagues.
Thank you very much, my friend. And it's
Thank you.
also my honor to be a mate in a great team. And I am sure that we will do many great things for the future of Endo with Expedient.
Yeah,
See you
sure.
later, brother. Have a nice
Thank you for.
evening. I want to send my best regards to dentists, our followers in Iran and in Turkey and all around the world. Bye bye.
Thank you.
See you later.
See you.